wanted to welcome Dr. Jason Comier, who is a gifted neurosurgeon, to share his experiences and thoughts on MiRus.
This is a 24-year-old gentleman who had an unfortunate motorcycle injury. He had this flexion distraction injury there at T12L1 and came in with an Asia C rating, so pretty much an incomplete motor situation. Had an epidural hematoma in the same region and had some pulmonary contusions. What I elected to do is a bilateral fascicectomy and then a minimally invasive instrumented fixation utilizing the MiRus system. And, very, very easy to use. The smaller rods, the smaller tulips, the lower profile, all those different things really provide such an ease in getting this instrumentation in. The bite on the screws is something that we haven't seen. So really overall, just a very, very easy to use system and a system that works consistently. And these are basically the incisions that I used. There are 6 total where I did the bilateral fascicectomies and then dropped some allograft down there to provide a fusion construct. Unfortunate lady who had a fall. She was 66 in her home, presented with low back pain to a hospital, really unable to ambulate, and had some lower extremity weakness. Her ability to move was primarily limited by her pain. So she had this L4 fracture with retropulsion. And what I elected to do was a minimally invasive approach to decompress the L4 lamina and then place pedicle screw fixation in a minimally invasive way to support her. And she did well. She was actually walking later on that evening, not really having some of the postoperative pain that I do see with some of the bigger profile systems out there. A 67-year-old guy, again, none of you guys have seen this, low back pain, neck pain, we've all seen it, degenerative disc disease with a retrolisthesis at L2-3. He had severe canal stenosis, really extending from L1 to 3. What I elected to do in a minimally invasive procedure is take this from L2, which was the most severe regions, from L2 down to S1. The size of this construct, the size of the screws and the rods made this a really user-friendly construct to work with. And it also reduced the operative time as well, trying to feed this rod through the tulips. More rod also has provided, being able to work with a rod that doesn't have, the recoil like, Mahesh kind of alluded to, and also being smaller with more durability, and you can get some precise bends on this thing. And if you have to correct it, you can correct it relatively easily, and you can correct it several times, and it's not going to fail.
Thank you again, Dr. Comier. Continue to stay safe during this COVID times.